Good day to you all. This time I'm gonna give you a new material for my contents on health issues. And today I'm gonna explain the health issues that's actually happening today. Uh, that's already happened in December 2024, and then it's still happening today in January. And you see that these cases is rising. It's not in China, but also it's already gotten this country in Indonesia. So let us see this material that I'm going to share that is called human metapneumovirus. Wait, now, all right, I already showing the screen. Now, my topic for today is human metapneumovirus or HMPV. Now that is actually, is it dangerous? Well, you have to know that the people that is in this country or even in the world are already shocked with this kind of new rising new cases because uh because of the rise of COVID. So people are starting to get panic uh even in the far even in the far east or the far west, maybe across the shores, maybe are they are getting afraid of getting this kind of virus. So let's see this. Let's let's open and talk about this. Discuss about this HMPV. All right. So basically, like I said before, because of the latest pandemic before that is happening is actually the coronavirus or SARS-CoV-2. It's already shocking and it's already killing people. It's even if it's not much, it's already bring people to its knees. Uh, there's gonna be another pandemic, the second pandemic, but it's not. So basically, we're in histories where when we reflect on histories, the histories about health issues, is no there's nothing new as happening in human history because you can see their plagues or even their pandemics is already happening and it's changed humanity. Actually, I'm gonna note there's some of this and wait, there's some of this cases that is actually changes the shape that changes the humanity, the world that we live in. Like for example, the Black Death that's actually killing one third of Europe. That's a lot. And then when something that struck in World War I that's actually killing that's which is actually the Spanish flu that's killing more than the casualties that are already happening in World War I. And then the avian influenza, and then also the swine flu. It's actually something that is very dangerous that is happening before. But what about the metapneumovirus? The metapneumovirus actually is divided into two. That could be avian metapneumovirus. Sorry, there's a typo here. And then the human metapneumovirus that's actually happening between us in this world. There's the rising cases that are actually happening these recent days. Now, HMPV, we don't have to be cautious because it's not this virus is not it's not new. It's already found in 2001 by a Dutch group that really successfully isolates this virus. And these cases that I said before is actually rising in China. So they are now the cases actually attacking children that is age less than 14 years old. So in maybe infants and toddlers. And this kind of virus, because of the latest pandemic before that's already happening, it's already giving shock, it's already giving these a horrific expression for the people, even in the Far East, Far West, or some sort of it. They are trying they are trying to ask this crucial question: Is the human metapneumovirus dangerous for us? does it can cause pandemic? Does it mean that we have to do another lockdown or some sort? Now we are gonna discuss this. So before we head into the later topics, we need to know what is human metapneumovirus. Now, human metapneumovirus or HMPV is actually a common virus. It's actually a common cause of for the respiratory tract infections in children's, adults, elderly, and immunocompromised patients. So, based on this definition, we know that it attacks in many kinds of people based on ages. It could be children, it could be adults, it could be elderly, and it could be person who has a weakened immune system. And the virus here that we see in this picture, I'm gonna wait. In this picture, you could see that this virus is actually that is actually being what they call composed of ribonucleic proteins and ribonucleic acids. So so we know from this picture that there are actually some kind of functions that actually really contributes to the people who's infected with human metapneumovirus. And this is the G component and the F component that will attach to the nasopharyngeal mucose. And I will discuss it in another topics. And as we can know that this is actually because of this nature, because of this nature that they have this component G and F actually, it it will help the person who is infected with the HMPV, it will be easier to infect the person from the respiratory tract. Now, after we know about this what they call the virus, let's continue. Now, as you can see that this family is actually the subfamily of this virus is Pneumovirinae and the genus Pneumovirus. Now, Pneumovirus is actually something that's if because of this nature, it's actually the family is actually related to respiratory syncytial virus. So the RS or the name that we always use is actually RSV. RSV is common, and actually the most common cause of bronchiolitis that's actually attacking children's less than 5 years old. No, in toddlers less than 5 years old. This is the main cause of it. It's actually attacking babies as well, infants as well. Now, after we know the subfamilies, the G, and we know that the RSV is actually related to the HMPV, we also know that the HMPVs actually have subclassification as well. So the human metapneumovirus is actually the subclasses, the classifications is actually coded in A1, A2, or B1 or B2. That I showed. This is the one I said earlier. This is the genomics of the the kinds of virus that is actually causing flu between persons. As you can see in this picture, there's this RSV. Wait, I'm gonna show you first. Sorry. All right, the RSV. Wait, what happened? Okay, the RSV, and then the human metapneumovirus and influenza virus. So I can see in this picture, both the RSV, HMPV, And HPIV is actually looks similar. The genomics looks similar in our eyes because of this similarity between of HMPV and RSV and HPIV. That's actually the main key for prevention of vaccines for people who's got the HMPV. Basically, HMPV itself, they try. The world doesn't have the vaccine related to that now. Remember that because virus is actually so hard to virus is actually mutates all the time, so it's very hard for people to actually make that vaccine. But the later section, I will explain that this there are actually the vaccines for for pneumonia, PCV, and also the for the influenza virus is actually being used for prevention today, and that will be in the later topic. So the epidemiology now is, like I said before, it actually is common in children. But based on my data that I found, HMPV is actually predominantly in children less than 2 years of age, with an average age of 22 months. And they can be also like in China, there's actually an article that said it's attacking children less than 14 years old. So there are approximately 19 or 200% of children that are infected by HMPV in the age of 5 and 10 years old. And 5 to 10% of pediatric who's hospitalized is actually causing an acute lower as a result of acute lower respiratory tract infections. If you have a kid that's actually less than 6 months of age, it could be the risk that could be hospitalized because of HMPV is actually 3 times higher than children whose age from 6 months to 5 years. So I said before, HMPV is actually common in children. So I have to so if you have young so if young infants, please be careful and take measures to save your children. Because in children, their immunity is so low. They have low immune system. Their immune system is still naive to the outside world. So please be careful when you bring your babies or your kids to every places that you want to go. And the epidemiology I got, there's some articles itself. You can see this uh this picture that I got here is actually showing the positive rates for people who will get RSV or HMPV. As you can see, the main that I said before, RSV is actually a common cause of acute respiratory tract infections, or this said in this pictures, ARTI. And in recent years, from 2022 to 2023, it's actually trying to be higher. It's actually tend to get higher. As you can see in this pictures, the cases is trying to, from 2021 to 2023, it's actually the cases positive rate is much higher. So this virus, which actually found in 2001 before, now is trying to set its fangs in this kinds of years, and we have to be careful, with it. But the question is it really that dangerous? Like coronavirus, is it really that dangerous? That will be set in the later discussion. I'm going to continue this. Though the epidemiology, you can see that these there are many kinds of genotypes that is actually found in every part of the world. And most cases, like this article, like this world map, you can see that even in Sumatra is being dominant with subgroup A, and Indonesia we have to be careful because the subgroup that this kind of genetics that genetics of the HMPP that we found is actually in group A2. But most of the world is varied. You can see it in this picture, and also the dots that they set is regarding genotype A or B or some sort. You can see that in many kinds of worlds, there are many genotypes that is actually found in all kinds of countries that found the HMPV. So this world map and all the epidemiologies that is related to HMPV, we have to learn it and we have to know because this genomic is maybe there are mutations that are gonna happen, and also there will be some kind of diseases that many where will be limitations, and also there will be differences in actually in genomics of the subtypes of the subgroups related to HMPV. So let's say how does HMPV actually spreads? So HMPV, like COVIDs or like any other influenzas, is actually spread through droplets. So I can see I make this scheme to make people a little easier to remember. It starts with droplets. So basically, like like you're sneezing something. Like like for example, if it's allergy from a dust or allergy from in cold weathers, we tend to sneeze now. Because of that sneeze, we might feel something that's actually is wet from our hands or some sort of, or even you can see it in our phones or as well. This is actually droplets that we see right now. Drop when person sneezes, there will be actually 100,000 of uh particles that are actually being sneezed that is contained in the droplets. Now for HMPV, the incubation period is 3 to 5 days. And by that 3 to 5 days, after the person who got infected from transmitted from the droplets of the person who was infected in the HMPV, they will actually inoculate in the nasopharyngeal mucus. And by that inoculation, the person that virus they will replicate and then enter, and then the last thing that happens is actually entering the lungs of the person. Now, but by entering the mucus and then the lungs, there will be actually something that is happening. As you can see that I said before, the protein G and protein M is actually responsible for for the infection of the person related to HMPV. And by that infection, there will be actually happening. There will be an immunopathology that is happening in the person. So you can see in the right side in the right picture is actually showing the acute phase of infection of pulmonary pathology. So in the acute phase infection, the person may, like I said, because of the infection in the mucus, actually they're gonna build some kind of immune systems that's happening in the person. They'll be activating either Mayer histocompatibility complex or MHC2, and then all kinds of cytokines that actually is used to fight the HMPV. But by time, these acute phase infections, like I said before, the last thing that will happen is actually gonna attack the lungs. Now, by attack the lungs, is also there will be cytokines, and cytokines that is essential for the inflammation and the pathology of the pulmonary system. They will either secrete interleukin 2, interleukin 6, the TNF alpha, and the interleukin 10, interferon gamma, and other sorts. This this kind of immune system actually is going to cause the person to have inflammation in the pulmonary system, and that will lead to either sneezes, coughing, or either the person will feel wheezing or shortness of breath, and the person also will maybe feel something that is hurting in the lungs or some sort because of the inflammation. Now, what are the risk factors or the HMPV? HMPV, like I said before, is actually mainly attack in children less than 14 years old, but it doesn't close the chance for the elderly persons who's actually more than 65 years old to get HMPV. So if you're an old person, you have to be careful with this too, because there are no guarantees. There are no guarantees also for older persons will get will get a mild symptom from the HMPV. So we need to be careful. And then the second is immunocompromised patients or the person with weakened immune systems. It could be HIV, cancer, or autoimmune disorders. Be all sorts of that. And so medications or steroids. Steroids is actually in this place is actually regarded as the as a as a strong medication. Steroids is also always given in diseases that is actually doesn't they don't know the cause of it, and they mainly use steroids to help the person be cured of their immune disorder or to control their immune disorders. That medication is actually something that is the steroids is actually something that's going to be a risk factor because they will weaken the immune system, and that's actually one of the risk factors for HMPP. And then diseases like asthma, COPD, these are comorbidities. Like asthma and COPD is actually immune disorder too, and you have to be careful. Be careful with this. If you have asthma and COPD, it's actually recommended for the persons who have vaccines too. To have vaccines like PCP or influenza vaccines to help them fight the HMPV. And then poor hygiene, like you are didn't wash your hands, or you didn't wear a mask, or you didn't do ethics in coughing. There are actual ethics in coughing too. That you have to wear a mask, or either you under the edge of your shirt you sneeze through that, and also you if you use tissue or some sort, throw it away in trash. And then the poor ventilation. Now, poor ventilation is actually something that people don't realize because there are many houses that actually has poor ventilations. The good ventilation, I think you can see in this picture, you need to have a clear way, like for example, like when in some kind of tunnels, from one side to other side, this have to be open. Now, like in this picture, yes, if if there's a fresh air is entering inside the house, it has to need to find a way to go out. By this way, it will help all the particles or all the other particles or dust or maybe danders of some sort. It could go out and be cleansed by the by the fresh air. Or maybe you could use an HEPA filter to help filtering the clean fresh air, because uh our air is actually not healthy. We need to, or maybe you realize there's actually a term, particulate matters. Our world is actually being filled. Actually, there's many particulate matters that's actually existing. And it's actually because of our air that's being polluted, and because of that, we need to. That's actually an important public health info for you all. So if poor ventilation is actually one of the reasons that HMPV cases risk that can occur. It's actually a risk for the person to get that HMPV. And the last one is sedentary lifestyle, like smoking, or obesity, or some sort. All these sedentary lifestyles will also be a risk factor for HMPV. So you have to be careful and take your body to healthy measures to prevent HMPV. And you can even see that it could be transmitted from close contact or contaminated service. So you have so if you're there so if your either floors or either some kinds of your stuff that's actually being contaminated because of the droplets, you need to clean it and be careful with it. Consider wearing masks protect you from the HMPV. And the symptoms. Now the symptoms is actually well, if you could say the mild one is similar to a flu. Like maybe runny, stuffy nose, cough, short, or you can have sore throat and a fever or rash or headache. It's actually like that. But if it's a more severe one, it's actually can relate to difficulty breathing or shortness of breath and then wheezing. It could be bronchiolitis, bronchitis, or pneumonia. So you have to be careful. It differs from every person to one another. If you are an young children or an older adults, you need to be careful to take this kind of measures. Please, uh, you can consider wearing masks when you are going outside or working outside. Now the common systems. Now the common systems is actually there are two types. There's actually classified into the upper respiratory tract infection (URTIs). It could be cough, rhinorrhea, or runny nose, congestion, your nose feeling stuffed, and then sore throat. And the lower respiratory tract infections or LRTI, it could be wheezing, fever, cough, dyspnea, and hypoxia. And in children, like I said before, it's bronchiolitis. Asthma exacerbations through pneumonia. This actually varies for people or for children that's actually infected. In adults, you can see in this picture, it causes pneumonia and same diseases that are actually happening. And then the last one is actually could be related to gastrointestinal symptoms. Maybe it's diarrhea, nausea, and vomiting. But it's actually not that really not that common, but it could happen for people who actually have comorbidities, age greater than 65 years old, immunocompromised patients, including those with HIV, cancer, those with immunomodulatory therapy, or even a recipients who have received transplants from other donors. You have to be careful. This is actually the symptoms that actually we need to realize. The common is actually URTIs, but the worse the LRTS is much worse. So we need to be So it's actually like similar to a common flu. Now the lab test is at the lab for the lab test. Actually, for the lab test is actually for now the majority is actually based on clinical diagnosis. It really doesn't require confirm lab test to confirm the HMPV, but it could be used for now commonly with the RT-PCR or reverse transcriptase polymerase chain reaction for nasopharyngeal swabs. Sometimes you could use radiographic findings, but it's actually the results of the chest X-ray is similar to bronchiolitis or pneumonia. But you could consider that if the persons actually have severe symptoms of HMPV. But for the most part, it's actually we don't really need lab tests, but it's based on clinical diagnosis for time. Maybe there are some sources that actually said you could use a chest CT scanning with a contrast. Maybe it's an image. It could help to evaluate LRTIs. Or it could there are many kinds of tests that actually have that can be used for HMPV. It could be ELISA or enzyme link immunoassays and immunofluorescence or QRT-PCR and new rapid antigen test. But as I said before, it's still not common to use it. It's still very limited. But you could consider it if you are interested in it. So now HMPV is actually is being used diagnosed based on clinical diagnosis. So regarding to the differential diagnosis, HMPV can be similar to pneumonia, influenza, acute bronchiolitis, acute asthma, or acute on COPD exacerbations. We need that's because of the similarity, like I said before, it's actually a little hard to notice what kind of disease is actually happening. The main the main the main diagnosis actually is now still based on clinical diagnosis. What is the treatment actually? The treatment, like I said before, because this is actually similar to influenza, there is no specific treatment, only supportive treatment. You could use antipyretics. It could either paracetamol or you could use ibuprofens, and then you have to drink water much. Or if someone is actually not capable of standing up or some sort, use fluid interventions. And if the person actually have difficulty breathing, use oxygen supplementations. It could be a high nasal cannula flow, or you could use an air mask for helping the oxygen supplementations. Because there are no specific antiviral therapy, there's actually being treated versus actually being treated with symptomatic care or supportive care. Use respiratory support care if it's required. But based on the if based on the new drug that's being tried to be trialed, is actually ribavirin. You could it's actually being considered to has been shown there's a broad activity against HMPV in vitro because of this, but it's actually still limited because it still remain controversial. It's still on the limit one. They still are not it haven't been used clinically on humans. But this could be alternative therapy for persons who is actually considering the antiviral treatments for HMPV. So to prevent this, like I said before, the in the former slides that I just said before, because of the similarity between HMPV and then the parainfluenza virus and also the RSV, the pneumococcal vaccine And influenza vaccines are recommended for person for now to prevent the HMPV for the HMPV uh, to cure. And based on what I found, is actually from NCBI, because there's actually some sort of study that's being used from other kinds of sources. So influenza vaccines is actually good for preventing 59% to 78% of asthma attacks. So, as you can see that in this article, maybe you are confused. It's actually I said this asthma attacks because there are many people who's actually getting asthma. So in order to is asthma. So in order to prevent these kinds of attacks, influenza vaccines could get this could give protection to the people itself. If it's not 100%, but it's actually helpful for people who is actually either is going to be asthma attacks or have influenza infection. So not to make the person who's got that infection became worse. And to prevent this, and to prevent this too, you can also learn the 6 steps or of washing your hands. This like this, and you can see in the pictures. And then the coughing etiquettes. I said before there are etiquettes in cough. And this like you could either close it with a cloth or handkerchiefs, and then you close it with the with the clothes that's actually in close in the upper limb, and then the in the up in the upper limb, and then wash your hands, or even you can use mask. Throw the if you use a cloth, throw it in the trash can. And the last thing that's not that is also important, we have to use this kinds of measures like we did in when the COVID pandemic is actually happening. It's either wash your hands, maintain physical distance, avoid touching your face, and stay home if you are feeling unwell. Prognosis of or the survival rate for this human HMPV is actually good. It's actually good. So basically, it's not that bad. It's not that dangerous. But if it's, but maybe reinfection could be cures because there are no persons who actually is immune to HMPV. So, so like I said before, it's not going to be that dangerous if you got HMPV. But remember, you have to protect yourself now, just like you protect yourself when you're being COVID. Even if it's a good prognosis, we can do safety measures for us so we could prevent this HMPV from spreading further. I think that's all that I have to share. That I have to share for you all. So thank you for hearing my materials about the HMPV. You could share it to other persons actually interested in HMPV or who's actually scared of HMPV, because even if it's even if the HMPV rise is even if it's not dangerous, there's nothing wrong that we that than doing safety measures to keep our family safe and also ourselves safe. That's for all. Thank you for watching this video.